Good morning. I'll talk today about Radiesse filler. First of all, Radiesse is 30% calcium hydroxyapatite and with methyl cellulose to make it soften to be ready for injection. So it's totally different from hyaluronic acid, which most of people they are using hyaluronic acid. But question now, why I should change and why I should use Radiesse, since I have a hyaluronic acid filler with many density. According to cross-linking, hyaluronic acid can be very soft, low density, then medium density, high density. So question, since we have also antidote for hyaluronic acid filler, it's easy to deal with its complications, but Radiesse filler, till now there is no antidote. There is many research about sodium thiosulfate, but it's not up to now applicable, and we can tell until now there is no specific antidote for Radiesse. There is no financial interest. I am not paid and I didn't come today to advertise for Radiesse, but I want to clarify some points about its applications and why it's better sometimes or most of the times to use Radiesse. Why Radiesse louvers? I am Radiesse man. I am one of the louvers of Radiesse. We will talk about its applications and about safety. First of all, we have some problems and some defects in hyaluronic acid fillers. Like what? It's known duration. Most of hyaluronic acid filler doesn't stay as long as Radiesse filler in the body. Why? Because if you try to make it longer in manufacturing, you have to increase the cross-linking, or you have to make the particle bigger size. You have to increase the concentration or to increase the cross-linking for hyaluronic acid, which is not authorized. If you make a cross-linking more than 30%, the FDA will not approve the filler. So you cannot make, for example, one of the companies, they make hyaluronic acid 97% cross-linking and it stay really in the body about 2 years. But this is not good because this material, if more than, it's carcinogenic. If cross-linking more than 30, you cannot use too much PDDE in the hyaluronic acid for the body. It's not good. Some people, it's carcinogenic, or it can enhance the immunity against, so you will have a lot of granuloma. On the other hand, calcium hydroxyapatite doesn't have cross-linking in between its particles. You can look at calcium hydroxyapatite filler as one of the component of the body, of our body. So it's a material in our bone. It's a material in our teeth. On the other hand, hyaluronic acid filler, it's not purified human hyaluronic acid. It's exactly human, but there is some component inside it which can enhance the immunity system. That means we can see a lot of cases of allergy when using hyaluronic acid filler because of it's made up from streptococcus bacteria. Streptococcus bacteria, it's in hyaluronic acid. As much you are highly purified manufacturing, but still there is some component of the streptococcus inside this filler. That means it's strange proteins. You cannot be 100% purified. So there is strange protein for our body, and it can make allergy for us. And the PDDE, the ether, which they are using in cross-linking, also is strange for our body. So we can have cases of allergy, and we can have granuloma. And as the percentage of cross-linking increase, the allergy, it can cause more percentage of allergy and granuloma. On the other side, calcium hydroxyapatite doesn't have any PDDE, or it's not from bacteria. It's not made up from bacteria, so we don't have strange proteins. So almost zero allergy, almost zero granuloma. Very, very, very rare to have to see granuloma after Radiesse. Even if it is staying too much, it's known permanent filler, permanent problems, because of its foreign body, and it can make repeated allergy, repeated reaction, which end by granuloma. On the other hand, it's hydroxyapatite, calcium hydroxyapatite. It's present in our teeth, in our bone, so our immunity system will not work against. So no, granuloma is almost zero. So this is one issue. So duration is the best between all safe fillers. All competitor, they will tell you, look, we can compare from Bolletero, Juvederm, Restylane, Tosyal. Okay, every company will try to tell you that my filler can stay in the body longer, but nobody will tell my filler will stay more than Radiesse, because this is why they call it semi-permanent filler, without problems of permanent fillers. So duration is the best, and consistency. What I mean by consistency, there is a law in filler. When you will choose hyaluronic acid filler under the eye, you want to inject under the eye, you will try to use low cross-link, because if it high cross-link, it will be apparent, and it will give mask-like. Especially in smiling. So you will try to choose a soft filler here in under the eye. What's about if you want to inject the chin? You will try to use high cross-link and hard filler to give definition. Also for Texas, you will give for bony. So there is a law in filler injection. As much you are near in your consistency to the filler, to the tissue you are replacing, as much you are more natural. You got my point? Calcium hydroxyapatite, it's exactly same consistency of bone. So if I want to inject the chin, I can have many options, like fat, hyaluronic acid, low cross-link hyaluronic acid, high cross-link hyaluronic acid, calcium hydroxyapatite. So which one is best? It's not matter of volume to volume. If it is volume to volume, that means whatever you fill, will give same result. This is not correct. Suppose you put fat for the nose, it will give a volume, but it looks ugly and fake because it's soft and you augment something solid. So people like surgeons, when they will do operation to support the dorsum of the nose, they will put something solid like rib, cartilage. They will take cartilage or anyhow something solid. They don't choose something soft because it will be fake. So we have to put something solid for the nose. This is why we have to put calcium hydroxyapatite is best filler of choice for the nose, because exactly same as if you put a piece of bone or cartilage, something solid. On the other hand, hyaluronic acid doesn't have the same G prime. This is why it will get loose and wide. So in my clinic, I don't inject hyaluronic acid for nose, and if patient came from other center, she did hyaluronic acid, I'll ask her to put Radiesse, to come back to her center and dissolve this by Radiesse, and then to come back to put Radiesse. Or I have to remove the hyaluronic acid and put Radiesse, and this is example. So it's best filler in its duration in the body, best filler in consistency for the bony prominence, jawline, chin, and nose, and even for hands. For hands, it's the first FDA approved filler for hand is Radiesse. Why in hand we prefer Radiesse? Because there is 3 targets in the hand. When we will inject filler for the dorsum in the hand, we have 3 aims. First of all, to give volume. Hyaluronic acid on the other side will give you volume as well. But what's about rejuvenation of that skin? You can use the filler to replace the volume, for augmentation, and you can use it as a treatment for the skin. So it's known that calcium hydroxyapatite is working in fibroblast, and it can enhance the rejuvenation, collagenesis for the hand rejuvenation. The third aim is that we have some veins. It's blue color. So we don't like this blue color to show. So if we put hyaluronic acid in between the vein and the skin, it's transparent. So it will show the bad color, the Tyndall effect. We call it Tyndall effect, but as a gray color. But Radiesse is not opaque it's not transparent, it's opaque for the light. So if you put in between the skin and the veins, it will fade. You will not see the blue line of the veins. This is why some areas Radiesse is extremely better than hyaluronic acid. Also, if you want to, for example, to put for the nose, for the chin, also extremely better with Radiesse, because for rejuvenation. If you want to treat the skin and in aged patients and they need facelift with filler, they don't like to do surgery, the best filler is Radiesse, the hyper-diluted Radiesse. We inject usually subdermal to give rejuvenation because it works on fibroblasts. This is so duration, consistency, and rejuvenation, collagenesis, and for Radiesse is better, does not make allergy. because it does not interact with any other material. So if patient, for example, they have a previous filler, permanent filler, and they remove it, we know already that it will not totally be removed, the RG foam, the permanent filler, and they want to replace their volume and skin treatment. Radiesse is better. If you inject hyaluronic acid, there is high chance to have a cross-linked, to have a cross-allergy and infection as well. Many cases after, if you make thread, so it's a solution for those people. It does not interact with any other material. If patient has hyaluronic acid filler in one area, you can add Radiesse above it, or opposite, there is Radiesse, it will not make any problem. And granuloma is almost zero. It's not zero anyway, but extremely less than hyaluronic acid. So now, what's about infection? It has natural antibiotic. It's a natural antibiotic, calcium hydroxyapatite. For areas, it's known it has antibiotic effect. Finally, I want to talk about safety. Somebody will tell, okay, it has a lot of positivities, but what's about antidote? What we will do if in case of vascular complications or overcorrection? What I can tell in this subject, that cases of ischemia after injection of Radiesse extremely less than hyaluronic acid. Why? All of the audience, they hear a lot about vascular every 2000. In Radiesse, you will not hear very little. Why? It's known that there is cross-linking. It's cohesive gel, so it's like a cohesive gel. So it's very difficult to get it fragmented, because there is plasticity. It will attach to each other. There is cross-linking to catch it to each other. So if you inject in the artery same amount of hyaluronic acid, high cross-linked, and same amount in same artery, Radiesse, you will see the chance of ischemia extremely more with hyaluronic acid. Because hyaluronic acid, it will act like cohesive gel. It does not dissolve in the blood. On the other hand, because no cross-linking, I did many experiments that I mix with lidocaine or with normal saline. I mix together, and it's totally homogeneous, because it's like a salt in a water. On the other hand, it's salt in a water. On the other hand, nobody will mix with normal saline, the hyaluronic acid with normal saline or lidocaine, because it will be defragmented. So there is pieces. It will be defragmented into small pieces. It's like emboli. If you inject it in the artery, there is high chance to have one ischemia, to block the artery and to cause a vascular spasm. Now there is theory of vascular spasm after injection of Dr. Yani. For example, Dr. Yani, everybody know Dr. Yani. He said, in my life, I inject same number, thousands of hyaluronic acid and Radiesse. I have 5 ischemia cases in my life. All of them was hyaluronic acid. And all of us hear a lot of ischemias after hyaluronic acid fillers, but very, very few and minimal cases after Radiesse. I know users of hyaluronic acid extremely more than Radiesse, but still safety with Radiesse is extremely high. Thank you. This is why I am Radiesse lover, and I advise you to inject Radiesse. I want to mention something also. Most of technique of Radiesse depend. Sometimes you need to inject purified Radiesse. On the other hand, minimal dilution standard 0.3 ml of xylocaine. But what's about hyper diluted? Sometimes 1:1, 1:2. That's mean dilution. As much diluted, as much viscosity is less. If viscosity come down, safety came up. What I mean by that? All of us, they inject Botox for forehead, mesotherapy, non-cross-link hyaluronic acid, PRP. We don't afraid of ischemia. But if I ask, please do filler for glabella or nose, everybody is afraid. Why afraid? Why with Botox? Because our enemy is the viscosity. It's not a big deal by mistake to go through the artery and inject a material. What is this material? If it is normal saline, Botox, if it is PRP, if it is, it's not a big deal. Mesotherapy, it's not a big deal. But if it is hyaluronic acid, high cross-linked, be sure that there is a high chance of ischemia. On the other hand, if you dilute calcium hydroxyapatite, does not have cross-linking in between each particles, and if when you dilute it, its viscosity is extremely low, so it will be very easy to flow in the artery and wash up without block. It will not block and the artery. And some theories now, they are talking too much about vascular spasm. Does not make spasm. So this is why for me, safety, I feel better with Radiesse in most of my application for time. Why we don't use calcium hydroxyapatite for lip? First of all, because of the color. Second, consistency. We were talking, it's not for soft tissue. It's a soft tissue and it's hard a little bit. And because of its color. Thank you.